Hi, I'm Dr. Salamay, and what I want to do is I want to talk to you about the 5 causes of chronic pain and what you can do naturally to start helping yourself on your road to recovery. So one of the things is with chronic pain is that we have trauma. That's one of the causes of chronic pain. Of course, it usually starts with acute pain because chances are is that when somebody gets injured or has some type of trauma, such as contact sports, falls, injuries, trips, all of these things can cause, of course, initially acute pain. But once it starts to progress longer than about 3 months, it can become chronic. And this is where things start to really get dicey, because now something that could be easily treated can become more chronic and more problematic. So what can we do? So macro traumas are what we talked about. These could be your car accidents. Micro traumas such as improper lifting. It could be also improper sitting and improper sleeping, our back support, ergonomics. So what can we do about this? So first of all, number one, we want to eliminate the stressor. So what we can to eliminate the stressor is unfortunately, we don't have much control over the big stuff. I mean, we can be very cautious. We could stretch. We could be cognizant of how we do certain things, but life is going to happen. Things are going to happen, and there's not a whole lot of control. But what we do have control over is what we can do about our posture, what we can do about our sitting, and how we can take care of ourselves. So sitting on a good pillow with a lumbar support, so making sure that our back is supported, that's important. We also want to make sure that we're sleeping on a pillow that is at level and at rest. We don't want our heads propped up, nor do we want our heads sagging. So we want a pillow that is firm, yet also soft and supportive. So these things that are important, this will help eliminate these further micro injuries or micro traumas to the already existing problem. Now, there are different therapies that we could do. Therapies such as chiropractic. There's some chiropractic techniques that work wonderfully for chronic pain. There are, you could also do stretching and physical therapy. And there are other types of modalities such as natural supplements that you can take that can help with chronic pain. So chronic pain is something that I've unfortunately had to endure with my own problems. So I've had to figure out ways that I could help myself, and usually utilizing measures of these type of modalities can help tremendously to get the body working better and get pain levels inhibited. So another thing is what I want to talk about, other than the stuff that we know about as far as the physical stuff, that like the big traumas, the accidents, even the micro traumas, just the sleeping on your stomach or sleeping wrong, sleeping on a bad mattress. What about the other hidden sources of chronic pain? And that's what I want to talk to you about today. I want to talk to you about the toxicity. That's number 2. So toxicity is a big problem, and it's ubiquitous. We are seeing it and we are experiencing it whether we know it or not, unfortunately. Now, toxins such as heavy metals, these are involved in the air that we're breathing, in the food supply, in the water, such as mercury. That's also in vaccines, in thimerosal, in amalgam fillings. So now that they're getting away, and more are getting away from those silver fillings in the teeth, but mercury is also a big one. Aluminum, lead, arsenic, so they are cadmium. These are all these different heavy metals that really cause a lot of inflammation in the body. And that's the big word that we want to hear about today, is inflammation. That is really what sparks the whole fire. That's what really triggers this whole pain pattern. And that's really what we want to crack. We want to crack that inflammation and stop it in its tracks. And the way we got to do that is, number 1, we need to be able to identify it. And then number 2, we need to support the body to make sure that the body is well equipped to handle the damage. And then we can repair and actually recover. So the things that we can do for toxicity, we have, first of all, number 1, we're going to try to avoid as many toxins as possible. So we can't live in a bubble, but we can do our best. Supporting the liver, supporting the colon, supporting the kidneys. These are all important. We want to make sure that we're getting enough fiber, we're drinking enough water, that we're eliminating. Because if we can eliminate through the colon, then we can put less pressure on the liver and on the kidneys. So they have less work to do as far as detoxification. And your liver is going to do most of the detoxification. So what can we do to help support the liver? We have dandelion. We have rosemary. We have milk thistle. We have things that support bile and bile movement, like beets. Even foods like beets are wonderful, and they do great. So they help support the liver, and they support liver function and detoxification. There are supplements that we can do to support liver detoxification. And as I mentioned, the rosemary, the dandelion, all these things are good supplements that one can take. We have an amino acid called L-glycine. L-glycine is very important for liver detoxification. It's part of the phases of liver detoxification. One of them is glycination. We have glutathione. Glutathione is a combination of amino acids. It's the most abundant amino acid combination and in our body that really eliminates the toxins in our body. So taking a type of glutathione, a reduced form of glutathione or straight up glutathione, can be very effective in supporting liver function. We also want to eat sulfur-rich foods. We want to eat foods that are rich in sulfur because sulfation is another important step in the detoxification of the body, not only in the liver, but in the colon. So foods that are high in sulfur, we look at onions, garlic, when we have our cruciferous vegetables, which are your Brussels sprouts, your broccoli, your cabbage, all of these things can really, really help and support the detoxification system. And not to mention that the cruciferous vegetables are rich in a compound called indole-3 carbonyl. I know that seems like a complicated word, but really what that does is it helps detoxify estrogen out of the body. And we use that to help detoxify lots of those estrogens. And estrogens may not just be that's just produced in our body. We're talking about estrogen, what we call as xenoestrogens. These are estrogens that are in our water supply. They're in pesticides. So they are endocrine disruptors, and they cause all sorts of issues. So supporting the liver with cruciferous vegetables or indole-3 carbonyl, that can really, really help tremendously. And DIM is one of my favorite ones for detoxifying xenoestrogens and estrogen in general, excess, because we don't want too much. Everybody needs some estrogen. Of course, women is more of a woman hormone, but also men also get excess of that. So we want to make sure that we take care of all those points and support the body and support the healing of the liver. So supporting liver tissue, vitamin A is very important for that. And milk thistle can be very, very effective for healing liver tissue. So we're going to move on. We're going to move on to the third point. And the third point is the chronic infections. So chronic infections also bring toxins of their own. So chronic infections, we usually think of bacteria or virus, but there are other chronic infections that happen. We have parasites and fungi. These are also issues that we all have to deal with, unfortunately. So what we want to do is we want to avoid as much as possible where we're getting these things. Make sure that we're avoiding undercooked meat that is way too undercooked or raw, rare. Especially pork products can have high amounts of parasites in them. So we don't really want to we want to be able to limit as much as possible pork. I personally do not eat pork. I try to avoid it as much as possible for medical reasons. But if you decide to have it, just make sure that you cook it and make sure that it's cooked enough, because pork does contain a lot of parasites. Trichomonas is one of the most abundant parasite that's involved in pork. So another thing is we want to do some things that we can help remove and support the immune system, so we can remove these microbes and toxins. So for bacteria, things that work well is olive leaf extract. We have oregano oil. We have different types of mint. They're very effective for bacteria. Colloidal silver is another one. These things are very effective. Echinacea. Echinacea is great for bacterial. It's great also for viral. We have elderberry that's very effective for the viral. And then we have antiparasitics. To get into antiparasitics, wormwood is an excellent antiparasitic. We have also cloves, black walnut. These are also good antiparasitic herbs. And garlic. Garlic is not only antibacterial, lowers your blood pressure, but it's also good against parasites. So another thing is fungi. So we'll get into the fungal. The fungal is also another problem, and really it loves to thrive off of sugar. So number one, I always say, let's make sure that we're not getting enough a lot of sugar. So we won't want to consume a lot of these things. And like I said, with fungal, is we want to make sure that we're not feeding the microbes. We don't want to feed them, and we don't want to get lots of sugar in our diet. So we want to avoid sugar altogether as much as possible. And then we also want to limit also the grains, because grains and starches are sugars, and they convert into sugar, and they can feed the yeast or the fungi. So effective things against fungal, I like pau d'arco, is a great herb for fungal. Also propolis is also great against fungal. These things are very, very effective. And of course, what we want to do is not only try to kill these bugs, but we also want to be able to support the internal environment, support that milieu or that intestinal environment, and supply it with good probiotics, because that can help tremendously. Especially Saccharomyces boulardii is one of my favorites for fungal and yeast type of issues. Then we're going to move on to the fourth point. Common food sensitivities can be involved with chronic pain, and they just happen over and over. We don't know about it. And they're very hidden sources, such as your wheat, your dairy, soy, eggs, even rice and corn. So these things can be hidden sources of inflammation that we just don't know about, and because we don't really necessarily feel any type of problem. So we don't know that they're causing inflammation in our bodies. And time after time, there's an accumulative effect, and that causes a whole spillover of these nerve fibers to cause our body to release and perceive pain. So what we want to do is we want to avoid all these foods altogether for a time period, probably I would say 30 days to give it a try, and start reintroducing one food at a time. If we feel that that food causes a bloat or it causes some type of irritability, then we know that the food is a problem. And the way we can also know is that if our pulse rate goes up about 8 to 10 beats per minute, then we know that that food may also be involved, even though we may not necessarily feel the bloat. The bloat could happen, or the irritability or the brain fog could happen hours later, 6 to 8 hours later, or even more, and we won't even know about it. So these are some things that we can try on our own and see if these foods are causing issues. Of course, we could also do laboratory testing. The ALCAT testing or the Leap Now test is a good test that I use to identify food sensitivity. So it measures basically how your immune system is reacting to a certain food, and also one of the other labs tests how your body's inflammatory responses to the food. So those two companies can they do a pretty good job in measuring and how your body is reacting or responding to certain foods. And that can be a big, people don't realize, but removing foods can be a big change for somebody. And just by identifying that can help tremendously. So what we want to do is we want to remove those foods, and then we want to support the body's digestive system. How do we support the body's digestive system? We can use enzymes, digestive enzymes that are rich in amylase, lipase, proteases, and these things help us digest fats, carbs, and proteins. So supporting our bodies with digestive enzymes can be a big win for us. So let's move on to the next one. And the next one, we're going to be talking about the psychological aspect or the emotional aspect of chronic pain. So chronic pain is not only biochemical related, but it also could be emotional related. So what we know is that anxiety can be a set-off for these pain fibers. And what they can do is they cause a heightened state. What we call is that central sensitization state, and that causes our nerve fibers and our brain to be much more susceptible or prone to perceiving pain. So for somebody who has a good threshold, they're right over here. Now, somebody has a centralized or sensitization state, a central sensitization state, that takes their threshold from here down to here. So whenever they eat something or there's any type of stimulus, it causes that to tip over, and they feel an experience of pain. And that's what we see with people with chronic pain, and that's what we see with people with fibromyalgia. So that is very essential that anxiety, whatever the source may be, whether it's truly psychological, it may be physical that's inducing it, but if it is psychological, that we address that. We address that through a therapist or a psychologist, or somewhere, I really prefer the natural route to really start addressing these things and addressing the sources of these things. So then there are things that you can naturally do to help lower anxiety. Of course, breathing, meditation, prayer, also taking in L-theanine, which is very effective for helping increasing GABA in the body. So it increases GABA in the brain. That's a neurotransmitter that helps calm and relax things. So doing these things and doing these measures, I think it will really help and really start getting your body on the road to pain relief and recovery. So I hope this gives you information that you're looking for with regards to the 5 causes of pain. Of course, there's a lot more to it, but I wanted to address the 5 main causes, or these common causes of pain. And by addressing these, once we start identifying them and we start addressing these, you're going to start to notice some changes in your body. So I really hope that you like this video. And if you really do, please give us a thumbs up, give us a like, and please hit that subscribe button and that bell notification. And I'll be happy to be providing you more videos of different topics. So if you have any other topics in mind, please feel free to put them in the comments below. And I'm Dr. Tony Salamay, and I want to wish you a great day.